بسم الله الرحمن الرحيم. السلام عليكم أعزائي الطلبة. المحاضرة الثالثة in Pharmacy Ethics. In this lectures we'll talk about common ethical consideration in pharmaceutical care practice. We need to make ethical decision in any work in pharmacy, hospitals, or any work that contact with the people. We need to know certain considerations or ethical consideration to help you to act with moral right behavior أو making moral right behavior. يعني المقصود بأنه أكو اعتبارات أخلاقية عامة موجودة في العمل الصيدلاني أو الرعاية الصيدلانية. هذه الأمور نحتاج أنه نعرفها عندما تكون كونتاكت مع المرضى مع البيبل، وهاي العلامات انه يكون سلوكنا سلوك more moral and rights. These considerations include تتضمن beneficence, autonomy, honesty, integrity, informed consent, confidentiality, fidelity, non-maleficence, loyalty and justice. Now, first one is beneficence. is a duty to do good. يعني هو المقصود بأنه إنه أنت لازم تعمل شيء جيد. It is about doing good, particularly doing what will benefit others. يعني أنت what the benefit to make to other patients, anyone else affected by ethical decision. This is seen in first principle of code of ethics. يعني الشيء الأساسية بالكود of ethics اللي أخذناه في المحاضرة الثانية هو care of patient is the first concern. يعني دائما العناية بالمريض هي أول اعتبار أو أول شيء لازم يسويه الصيدلاني أو يخليه في باله. The principle of beneficence is that morality requires more than just staying out of the another way. We may obligated to stay in the aid of others. Beneficence-based rationale of the behaviorism profession like parents. يعني هنا معناه البيترنياليزم معناه الأبوة. يعني البروفيشن لايك بيرنتس يعني أنت مثل والدك known the best يعرف أكثر من الطفل. يعني إنسان كبير واعي يعرف أكيد أكثر أو قراراته أكثر في مصلحة الطفل. Child and patient sometimes exclude from decision making. يعني الطفل لا يستطيع أن يأخذ قرار نفسه أو يعني because lack of education. يعني إنه معرفة and minimal understanding about the consequence of choice. والفهم القليل حول نتائج اختيار. It has become clear that because of significant disparities in power, information, and experience, the potential for materialistic practice is embedded in all interaction between healthcare and professional patient. Sometimes, examples, the old women with hypertension are refused taking medicine. يعني مريضة old women may sometimes يعني ما يأخذ أو يرفض أن يأخذ لعدم education, good education, عدم understanding about concepts of choice. يعني هذا hypertension may lead to stroke, renal vascular disease, many diseases, other diseases as cardiac disease. Okay. Now, as important participant in this relationship, pharmacists can find themselves involved in the paternalistic conflict regarding refusal of patient request for particular medication or disclosure or non-disclosure of information. If obsessive patient examples, if obsessive patient want to know everything about the drug is used. Problem in beneficence. Benefits the patient may harm himself, the sociality or other people know the patient. Example, pharmacist family health is conflicted with other goods. Patient who examples as example patient who choose to reduce antihypertensive medication Mr. Ahmed have hypertensive may use it as atenolol. Atenolol as a drug used for hypertension. His wife Raw'a also hypertensive using torsemide. Torsemide is a drug also used for hypertension. they decide without advice or physician. قرروا يعني هم اثنينهم واحد ياخذ اتينول وزوجته تاخذ توراسامايد تاخذ مدرب وهذا ياخذ بدل. قرر انه بدون نصيحة الطبيب انه مفروض توقف في علاجها her and share his husband medicine والشارك يعني تعطي زوجها العلاج مالتها والشارك فيه being less expensive لأنه أقل رخيص because they needed the money to fill electricity bill since weather is became warmer and they cannot withstand. Autonomy. In the other consideration we talk about autonomy. Autonomy معناه الاستقلال. Autonomy is about allowing individual to have rights. يعني بعض القرارات انه ياخذها المريض to make decision for themselves. Again, this right is tempered if one person decides is likely to have a full effect on it. يعني الاستقلالية أو واحد ياخذ قرار الشخص آخر also dependent on individual ability to appreciate understanding should take is use androgen by body builder. يعني بعض الناس ينصحون البودي بيلدر انه ياخذون اندروجين وياخذ قرار او استقلال او هو مستقل برأيه انه انا راح اخذ هذا الدواء الاندروجين اللي على مود يبني لي بناء building of the muscles. لكن هذا القرار خاطئ. هذا يعني ليس صحيح. قد يسبب harmful to yourself. Pharmacist autonomy. Pharmacists sometimes feel that they pressure to do things they feel useful for the patient, putting their own need for job ahead of their patient need. Professional pharmacists do what is right, not what is convenient. يعني يسوي الشيء الصحيح وليس الشيء المناسب. الصيدلاني. Example: the pharmacist dispense unlicensed drug because it's prescribed by physician. يعني قد يعني الصيدلاني يصرف دواء غير يعني unlicensed يعني دواء ما موافق عليه ال FDA أو يعني not approved إنه بفائدة وينوصف عن طريق الفيزيشن. This is related to professional work of the pharmacist. Pharmacists are always in conflict position, waiting the patient right for information and decision ethical for non-closure. Example will be non-disclosure of the side effects of the drug by physician. Prescribing the cancer chemotherapy, physician may not want the patient to be informed of the side effect as may be leading to patient inconvenience. Honesty. الموضوع الآخر honesty and integrity. Honesty is telling the truth to others. الhonesty هو قول الشيء الصحيح للآخرين. Integrity is telling yourself the truth or doing right things in a reliable way even when it is not acknowledged by others or convenient for you. Example with an integrity. You are boss in the pharmacy. Good boss make constant effort to appreciate staff contribution and give them trusted for job well done. Return money that will be not some dropped without expecting reward. يعني أنت تلقى نقود واقعة على الصيدلية تعطيها صاحبها هذا تعتبر من نوع من الانتجريتي. ويعني أنت إذا كنت بوس الرئيس في الصيدلية لازم أن تعطي يعني make constant effort to appreciate staff contribution. الموضوع الآخر informed consent. يعني الموافقة المسبقة. Principle 3 of the Code of Ethics require respect to show it for others. يعني أنت لازم ethics من ضمن ال Code of Ethics respect is shown to others. This is include the legal and professional duty to obtain consent from patients for any service or treatment you provide to them to use any information that you obtain from them. يعني أنت لازم تأخذ موافقة من المريض لأي خدمة أو أي علاج راح تجهزه به أو استخدام المعلومات اللي يدلي بيها لك. Type of consent: informed consent أما تكون verbal consent أو تكون written consent. sorry. Implied consent is not given by patient but is referred from his action or inaction, holding the arm in helpful setting for the blood pressure, cough and cold. يعني بعض قد يكون لفظي، قد يكون موافقة مكتوبة، قد يكون يعني فعل، يعني هو يمد إيده يريد تقيس الضغط. Confidentiality. موضوع الآخر. Pharmacists have the duty of confidentiality for both ethically and legally. Principle 3 of Code of Ethics also contain requirement to use patient information only for purpose of which it was obtained. This is addition to legal requirement of data protection. Technology have improved and a number of legislation acts of the parliament have been passed to control the use of data. يعني أصبحت أكو يعني تشريعات برلمانية الكنترول يوزز اوف داتا، يعني بيانات المريض ما يمكن انه تفشي بيها. هناك يعني بالخارج اكو بيانات تسجل بالصيدليه بيانات المريض، فانت مو انه تفشي بيها او تقولها لاي احد. It is unethical to discuss or disclose the person's health related information about your patients with one of your friends. يعني ليس unethical أنه تشارك معلومات المريض أو تفشي أسراره with one of your friends مع أصدقائك أو family member who not a healthcare provider and will not involved in care of that patient. Suppose you receive phone call from someone. We say that she is pharmacist at hospitals and they are unconscious patients we appear to have taken a drug overdose. The patient have the medication report card from your pharmacy. Will you tell the pharmacist what medication he is taking? Before giving this information, you must take all reasonable steps to establish that this call is genuine, and so might obtain the number of the hospital from independent source and then form to check that someone of the name you have been given is working there. يعني شخص انه يتصل بيك ويقول لك انا صيدلاني او يقول لك انا طبيب او يقول لك انا اريد هذا المريض معلومات عن هذا المريض ما مسجل في سجلنا الخاص الموجود في الصيدليه. انت المفروض تتاكد من عنده، تتصل على رقم تليفون المستشفى وتتاكد انه هذا فعلا انه يعمل الامر. Data can be disclosed in certain circumstances. البيانات يمكن أن تفشى أو أنه يعني تقول بها في حالات خاصة، مثل request from other firms، طلب من صيادلة أخرى and general practitioner and in the interest of patient safety. Police officer، الشرطة إنه هو investigator أو محقق يريد بعض المعلومات. judges and coroners in the process of justice and inquest. In events of courts ordering the information disclosed, the pharmacist could be prosecuted for failing to disclose the requested information. Now, thank you for listening.